Bismillah ar-Rahman ar-Rahim. Assalamu alaikum warahmatullahi wabarakatuh. Today we are going to continue our lectures in oral histology for second year student, Al-Kabil University College of Dentistry. Our lecture today is under title of Alveolar Bone. Alveolar bone. The jaw bones consist of basal bone, which is portion of the jaw located apically but unrelated to the teeth and the alveolar process. The alveolar process is the portion of the maxilla and mandible that forms and supports the teeth sucked alveoli. It provides the osseous attachment to the periodontal ligament and disappear gradually after tooth is lost. So all the jaws, upper and lower mandible and the maxilla, consisting of the apical portion اللي يسميناه البيزال bone, هذا do not related to the teeth, and the coronal portion اللي احنا سميناه الالveolar bone that support the tooth socket alveoli. Alveolar process consisting of the following parts. هذا الجزء اللي قلنا يحيط التوث and supported يتكون من 3 أجزاء. الجزء الخارجي the first one an external plate of complete bone اللي احنا نسميه cortical plate formed by Haversian bone and compact bone lamellae. Cortical bone vary in the thickness in different area. It is thicker in the mandible than in the maxilla and thicker in the premolar molar region than in the anterior teeth region. The second part, the alveolar bone proper, form the inner socket wall consisting of a thin compact bone. Histologically, it contains a series of opening cribriform plate through which the neurovascular bundles link the periodontal ligament with the central component of the alveolar bone اللي هو Cancellous bone. Also, this alveolar bone proper is also called bundle bone because these Sharpeys fiber اللي هي termination of the periodontal ligament inserted here similar to that of the cemental surface. يعني هالperiodontal قلنا احنا fiber insertion يصير عندها جزء الطرف في الالفيولار بون اللي احنا سميناه البندل بون والجزء الآخر وين يكون بالسيمنتال سيرفيس. These Sharpeys fiber اللي يصير بيه insertion بالالفيولار بون proper عادة يكون inserted at right angle, few in number لكن thicker in diameter than those اللي هي موجودة بالسمنتم. As in the cellular cementum, هذه Sharpeys fiber in the bone are gradually and generally mineralized only partially at their periphery. يعني the same بالسمنتم وبالalveolar bone proper تكون إذن mineralized partially at its periphery. هذا الدايجرام يشوف لنا هذا longitudinal section بالمانديبل، فهذا هو الابيكال بارت سميناه البيزل اللي هو ما إله relation with tooth، لكن الالveolar process هو going to support it and include the tooth. الجزء الثالث Cancellous trabeculae اللي هو Spongy Bone fill the area between the cortical plate and the alveolar bone proper. It contains trabeculae of bone and marrow space. Spongy bone is very thin or absent in the anterior region of both jaws. So, إذن alveolar process عندنا يتكون من الأوتر اللي هو الكورتيكال بليت، من السنترال الجزء اللي يكون in the between the outer and the inner اللي هو central spinogia، وعندك الانر lining alveoli اللي سميناه البندل بون. Types of spongy bone, we have two types. First, type 1, trabeculae are regular and horizontal like a leader in the cellum. This is seen almost in the mandible. Type 2, irregular, arranged and delicate with numerous trabeculae. This is seen mostly in the maxilla. Alveolar crest. The shape and position of the alveolar crest depended on the adjacent teeth. In healthy mouth, the alveolar crest is around 1.5 to 2 mm below the cementoenamel junction. يعني عندك المسافة ما بين الالفيولار كريست إلى cementoenamel junction بالهيلثي ما تزيد عن 2 ملم، 1.5 إلى 2 ملم. فإذن بالهيلثي ما أزيد عن هذه المسافة. This section shows us the alveolar bone. This is the basal bone. Because alveolar process is regularly penetrated by collagen fiber bundles, it is also called bundle bone. It appears more radiodense than surrounding supporting bone. In the X-ray we call it lamina dura. But then bundle bone, it is perforated by many foramen that transmit the nerve and the vessel اللي احنا اطلقنا عليها الكريبريفورم plate. Radiographically هذا البندل بون it is the lamina dura، يعني مصطلح عندنا نستخدمه بالراديوغراف. هذا البون بندل نطلق عليه باللامينا ديورا. This lining of alveolus is fairly smooth in the young but rougher in the adult. Radiodense because increased minerals contains around fiber bundles. فهذا لو نشوف هذا الأرو، هذا هو الخط اللي نشوفه أكثر بياضا من المنطقة احنا نسميه راديو أوبيك. فهذا هو اللامينا ديورا اللي هو بندل بون. وليش يكون مور راديولوسن ما راديو دنس؟ لأن عندنا مور مينرالز. هذه الصورة تكون أوضح. عندك هذا هو الالفيولار كريست، هذا هو عندك اللامينا ديورا. This is the lamina dura اللي هي الالفيولار بون بروبر أو البندل بون. Bone is very dynamic tissue that is always undergo changes to adapt for the functional forces اللي هي mesial drift, eruption process of the tooth. So there is a constant formation and resorption of the bone. Period of resorption alternate with period of rest and repair. Gingiva attached to the alveolar process, and the bone has a commandation to allow blood vessel to enter for the purpose of supplying blood to the teeth. So, any damage for alveolar bone can cause serious consequences, including risk of losing the teeth and septicemia if the damage is caused by an infection. Alveolar crest, as I said before, it is about 1.5 to 2 mm below the level of the cementoenamel junction. إذن بالhealthy هذه هي المسافة. فإذا if we draw a line connecting cementoenamel junction of adjacent teeth، يعني من cementoenamel junction مال هذا التوث إلى adjacent، هذا اللاين should be parallel with the alveolar crest. هذا بالحالة الطبيعية healthy. لكن if this line is not parallel, that means there is probability of what we call it periodontal disease. لأن هذا معناتها أكو عندك pathogenicity بالمنطقة، يصير عندك destruction alveolar bone، فزادت عندك alveolar crest has been decreased نتيجة الresorption بالalveolar bone، وبالتالي راح نشوف هذه هي الصورة من periodontal disease. Now the osteogenesis, development of alveolar bone. Alveolar bone develops from dental follicle. من ectomesenchymal cell, undifferentiated ectomesenchymal cell, which is found in the dental follicle. This is going to be differentiated into osteoblast, which will later lay down the matrix, the osteoid, the first layer of unmineralized bone. These osteoblasts become embedded in the matrix, and now we call it the osteocyte. بعد ما تطيب الأوستويد تصبح inactive و embedded with الماتريكس bone، فنطلق عليها الأوستوسايت. فإذا الأوستيوبلاست من تكون inside the matrix تتحول تصير أوستوسايت. cells and intercellular matrix. السيلز الموجودة عندنا الأوستيوبلاست. These are mononucleated and it is responsible for synthesis and secrete the bone matrix, وهي differentiated from the undifferentiated mesenchymal cell in the dental follicle cell. Osteocyte, it is inactive osteoblast that going to be embedded within the bone matrix. Osteoclast, this cell responsible for the resorption of the bone, and these are large, having about 15 to 20 nuclei derived from the monocyte macrophage. It contains acid phosphatase enzyme, more mitochondria, less rough endoplasmic reticulum. They are always found in a concave areas known house-shaped lacunae. So, this is the osteogenic cell, undifferentiated, is going to be differentiated into osteoblast cell, active one, اللي تعطيني الأوستويد، بعدين تتحول إلى inactive osteocyte within the osteoid matrix. This is the osteoclast, multinucleated cell responsible for resorption of the bone. Now the matrix. الماتريكس of the bone يتكون من organic and inorganic. نبدأ بالinorganic. It composed principally of minerals, calcium, phosphate, along with hydroxyl, carbonate, citrate, trace elements of other ions such as sodium, magnesium, fluorine, and these mineral salts are in form of hydroxyapatite crystals. The organic matrix consists mainly 90% of the collagen type 1 fiber with a small amount of non-collagenous protein اللي هي الأوستيوكالين، الأوستيونكتين, bone morphogenetic protein, phosphoproteins, and proteoglycans. So, a review of the structure of the bone. It consists 10% of the cell اللي قلنا أنواعهم الثلاثة، وعندك about 90% of the bone it is the matrix. هذا عندك مثل ما قلنا حوالي 40% هو organic و 60% inorganic. What are the lines that we can see in the bone? We have two types of lines. First, resting lines. These lines correspond to the resting period in the process of osteogenesis. يعني من يصير عندك deposition of a new matrix bone، حيصير عندنا هذا خط ما بين القديم والجديد نطلق عليه resting lines. Reversal line, these are when you have a period of bone resorption followed by bone formation. There will be dark line seen which separated the new one from the old bone. This is resemble the shape of house-shaped lacunae. Blood supply of alveolar bone. First, alveolar process of the maxilla. This is by anterior and posterior alveolar arteries branches from the maxillary and infraorbital arteries. 2. Alveolar process of the mandible, supplied by first inferior alveolar arteries internally, periosteal branches of submental and buccal arteries. This is externally. Functions of the alveolar bone. List of functions. Let's start it with the protection. Alveolar bone forms and protects the socket of the teeth. 2. Attachment. It gives the attachment to the periodontal ligament fiber, which are the principal fibers. These fibers which enter the bone and regard as Sharpey's fiber. It helps absorb the force placed upon the tooth by disseminating the force to underlying tissue. Also, it gives support that it supports the tooth roots on the facial and on the palatal lingual side. It is a shock absorber because it helps absorb the force or extra force that placed upon the tooth by alternating and disseminating this force to the underlying tissue. So it's just like absorbing for any extra force that's applied on the tooth that transmitted to the underlying tissue. What are the 8 changes in the alveolar bone? First, we have brittleness due to decreased water contents. 2. Osteoporosis. 3. Alveolar crest slope distally due to mesial tilting and drifting of the teeth. 4. With the loss of the teeth and resorption of alveolar ridge mantle foramen become very close, also the maxillary sinus and the upper jaw. فإذا ال 8 changes بالبون: brittleness نتيجة قلة الووتر، osteoporosis الهشاشة، الالفيولار crest sloping distally نتيجة للميجال drifting of the teeth. بمرور الوقت نتيجة فقدان للأسنان ويصير resorption بالالفيولار ريدج، نتوقع أنه المنتال فورامين باللور جو بالماندبل وماكسيلر ساينس بالأبر جو أن يكون very close to the alveolar ridge. This is have to be considered in the clinic during extraction. مجموعة من التعاريف. نبدأ بالinterdental bone, the bone between the roots of adjacent teeth. Interradicular bone, the bone between the roots of the multi-rooted teeth. Spongy bone, cancellous, porous portion that lines the marrow cavity unfolded in the epiphysis of the long bones. Compact bone, found on the outer surface and it is highly vascularized. Compact bone is dense and contains Haversian system. Woven bone, meshwork of immature, non-organized bundle of collagen inside an osteoid. Bundle bone, part of a alveolar process that forms a cribriform and circumferences around the teeth and forms attachment to the periodontal ligament. Laminar bone, secondary bone formation that consists of laminar rings and the collagen fibers are arranged in a dense spiral sheet. Trabeculae, little depression of bone caused by osteoclast resorbing bone. Osteoid, non-mineralized portion of the bone secreted by the osteoblast. Sequestrum, a portion of the bone that has been detached from the parent bone. What are the clinical considerations that you can take it in your clinic? The most important one, the resorption and regeneration of the alveolar bone. This process can occur during the orthodontic movement of the teeth. Bone is resorbed on a side of a pressure and deposition and apposition on the side of the tension. That mean فكرة الأرثودونتيك movement جاية من هذا المبدأ resorption and regeneration. So when you want to move a tooth, what there will be bone going to be resorbed on the side of a pressure. يعني عندنا سايدين, side of pressure نسميه side tension. فالresorption يصير بالside of a pressure والaddition when يصير بالside of tension. And by this very simple principle, the orthodontic movement going to begin. Decreased bone احنا نسميها osteopenia of alveolar process is noted when there is inactivity of the tooth that does not have an antagonist. يعني ما عنده antagonist، يعني سن مقلوع إذا هو بالأبر، ما عنده antagonist باللور، فنتوقع أنه يصير osteopenia. Please don't hesitate to contact me if you have any question about this lecture or previous lectures. And we have a little quiz. MCQ. You have 2 questions, which is from this lecture, and it's very easy to answer it if you study this lecture. This is the can. Thank you for your listening. With my best regard, Prof. دكتورة خلود الصافي، كلية طب الأسنان، جامعة الكفيل.